Yep, slightly less on the left side.
Less, okay, so that's S1, this is L5, this is L4.
Slight numbness at the bottom. Through my shin, I can feel my
Through your
shin
shin,
tingling.
yes?
Yeah.
Okay. Any pain?
More stretch in the hamstring, slight discomfort on the left side.
Slight, okay. Any sensitivity?
Yes, on the left side.
Yeah. Push up for me. 1, 2, 3, test, rest.
Oh God, that's a lot harder.
Yes. Right side 148, left side 103.
Yeah.
Okay, so that's 45.
Yeah,
okay,
big difference, yeah.
Big difference. What's up, everybody? Dr. Ranen here. Today I'm with Ranen. Ranen is a broker and an online coach based here in Dubai. He has a 1-year history of lower back pain with referral into the left leg. We've had a look at his MRIs. He's got 3 consecutive disc injuries or disc protrusions, L3, 4, 4, 5, and L5S1, all compressing the left nerve root. And that's caused him significant atrophy of the muscles in the left leg. Now he's pain-free, correct? No lower back pain, no nerve pain, but he is in prep for competition. And one of the things that he's struggling with is he's having difficulty connecting with the muscle in certain ranges of motion. That's the quad, hamstring, and glute, yes? Okay. So today we're going to do something special. We're going to use the Vald dynamometer to measure muscle strength between the right leg and the left leg. We're going to do some treatments, and then we're going to reassess, and we're going to see if we've been able to improve his motor control. That's the connection between the brain and the muscle. All right, he before I forget, he's also having some numbness in the lower limb. So we're probably going to do some muscle testing of the foot and see if anything is going on there. All right, let's get going.
Just break away from the
That's true. Lift your toes for me, please. I'm going to push down, resist. Good. Here. Lift up. Good, good, good. Great. Toes down. Hold for me. Good. Hold for me. Hold, hold, hold. Good. Can you feel this?
Yeah.
Same?
Slightly less on the
Less.
left one.
Okay. Here.
Yeah.
Same?
Yeah.
Here.
Yep, slightly less on the left side.
Less. Okay. So that's S1. This is L5. This is L4. This is S1.
Mm-hmm.
How's that?
Fine.
Fine. You feel
Yeah.
it?
Yeah.
Here?
Yes.
You do?
Yeah.
Okay. All right, let's get you to straighten your right leg for me, please. Toes towards you, chin down, bend forward. Any pain in the lower back or stretching in the leg?
No.
Opposite leg for me, please. Toes towards you, chin down. Any stretching or discomfort?
Just loads of stretch in the calf.
Stretch in the calf. Okay.
Yeah.
Let's get you to stand for me, please. You're going to face that way. Any pain in the lower back here?
Just on the left side.
Left side, okay. Here,
No, that's okay.
here,
Slight irritation on the left side.
left side,
Yeah.
okay. Here,
No.
here.
No, it's okay to be fair.
It's okay. Bend
Yeah.
forward for me, please. Any discomfort?
No, slight numbness at the bottom. Through my shin, I can feel my
Through your
shin
shin,
tingling.
yes?
Yeah.
Okay.
But nothing through the back.
All right, let's get you on your back for me, please.
Ooh,
Other
on my
back. Yes.
Oh, face back. There we go.
Oops.
Oh, sorry.
This up here, no problem. Okay. So even though Haven's not having any lower back pain, you can see that when we stress the joint on the right side, he's still having some discomfort through. Yeah? Sorry, on the left side, yes?
Left side.
Yeah. Oh, sorry. Right leg first. Leave it loose. Any pain in the lower back?
No.
Any stretching in the leg?
Slight in the hamstring, but I
Slight,
just think
okay.
that's normal hamstring tightness.
Leave your leg loose. Any pain?
More stretch in the hamstring and slight discomfort on the left side.
Slight, okay. All right, let's get this off here from you for a second. Let's get you face down, please. So when do you intend on competing?
You know what? It was going to be end of this year, but I want to start prep in November. Ready for early 26 now, to be fair.
Yeah.
So.
Are you coaching yourself?
No, I have a coach.
Okay. Any pain here?
No.
Any pain here?
No.
Any pain there?
No.
No. Good. Okay. So that's L4. Any pain there?
No.
No. That's L3. L3. L4. L5. S1. Okay.
Why does it go from L to S?
Because L is lumbar and S is sacrum, yes.
Okay.
So you have 5 lumbar,
Yeah.
and then you have your sacral vertebra.
Got it.
Okay. T. T is thoracic, so that's higher up, just above lumbar. You have 12 thoracic vertebra. Okay. Any sensitivity?
No.
Relax here. Any sensitivity?
Well, just tingly from just like pressing.
Tingling,
like
okay.
Yeah.
Here,
No, that's all right.
here,
No.
no. Here,
More numbness.
no. Okay. Where are you from in the UK?
Derby, right in the middle.
Derby.
Right in the middle.
Sensitive?
Yes.
Yes. Derby County.
Yes, there you go.
That's a football team. That's
got it.
that's the only reason I know Derby.
That's good, fair play.
Any sensitivity?
Yeah.
This morning I was in the lift heading to the gym and I saw someone in a Norwich kit and I was like, "Is that a Norwich kit?" And he was like, "Yeah, how did you know?" I was like, "The Premier League."
You're fair play. That's very good, to be fair.
Sensitive?
No.
No. Okay, but here, yes.
Yes.
Okay.
What I started doing as well is single leg glute work as well.
Yeah.
Like
You feel the side shaking quite a bit?
massively.
Yeah. Okay. Any sensitivity in here?
No.
Any sensitivity?
Yes, on the left side.
Yeah. Yeah. It's
Yeah. Oh.
nothing in there.
No, that's okay.
Okay. All right, guys. So what I've just done is it's called a sensitivity reflex, and what I'm trying to do is trace the points where the sciatic nerve is most superficial to the skin, or where certain nerves that are responsible for pain or muscle stimulation are most sensitive to the skin. So here we have the posterior femoral nerve. Here we have the inferior cluneal nerve, which lies just under the buttock. And here we have your superior cluneal nerve. So these are just indications of points that I need to work on where nerve irritation could contribute to muscle tightness or some type of motor dysfunction. That would mean muscle weakness or muscle inhibition. Okay, let's get you to sit for me, please.
Cool.
Now, what you guys may hear in the background going off and on is the valve device. It's ready for us to use. Okay.
If you ever want to do a leg session, let me know.
Oh yeah, sure.
And if you ever wanted to record it, then you can see the
That's a good idea. Yeah.
differences. Because I do a hamstring session and I do a quad session.
Oh, me too. I also do a hamstring
So-
session and quad session. Yeah, I got my quads on Sunday. This week's been very
Messy.
yeah. I'm getting in and getting it done, but I don't have the drive.
Yeah.
Yeah,
Happens though. It's
like
that motivation versus discipline, isn't it? Like,
yeah,
your motivation's not there, but your discipline's like, right, I'm going to keep going.
yeah.
I'm saying me this week, I think I've averaged 4 hours sleep a night, just working late. And I said, right, no matter what, up at 4.
Yeah,
Up at 4,
ready to
up at
go.
4.
It's the same thing. I'm going, but I'm interested to see what my points are at the end of the
Yeah.
week, my body fat percentages at the end of the week. Anyway, I guess you're going to have weeks like this. Yeah.
100%.
Okay, guys, so we're going to do some VALD testing. So this is called the Dynamo by a company called VALD, and it's a assessment tool. So what we want to do is we want to assess Harvin's oops, sorry. Here you go. So what we want to do is assess Harvin's isometric strength. Now, there are three types of muscle actions: concentric, eccentric, and isometric. And isometric is something that we can test and we can get a reading of. It's basically going to tell us what the communication between the brain and the muscle is like, okay? And that's going to tell us what type of work we need to do. Okay, so we're going to start off with the right side. Let's go.
Saving them this time.
Yes.
There we go.
Ready to test. There we go. Okay, right leg. All right, so what I want you to do is just hold on. Yeah, there we go. Okay. And you're just going to push from this position, okay?
Push towards you, yeah?
Yeah, I'll tell you when to go. One second. Sorry, I need to zero this. Okay, push. 3, 2, 1, rest. Okay. I'll tell you when to go. Push. 3, 2, 1, rest. Push. 3, 2, 1, rest. Done. Okay, push. 3, 2, 1, rest. Okay, push. 3, 2, 1, rest. Go. 3, 2, 1, rest. Go. 3, 2, 1, rest. Done. All right, let's get you face down for me, please. Let's pop this out.
Oh, yes.
Bend here for me. So we're just going to do 90 degrees, okay?
Yeah.
Can you zero the device there for me, please? Just hit 0. Okay. Oh, yes, this is right side, yes? Okay.
Yeah.
Okay, go. 3, 2, 1, rest. Okay, bend for me. Cramp?
Yeah, it's like cramp.
Sorry.
No, sorry.
Okay. Okay, go. 3, 2, 1, rest. Okay, last one, go. 3, 2, 1, rest. Great.
What is this?
Hamstring. Bend for me. Okay, go. 3, 2, 1, rest. Go. 3, 2, 1, rest. Go. 3, 2, 1, rest. Done. Okay. All right. We have hip extension now.
Yes.
Okay, so you're going to bend the knee and then you're going to lift up for me, okay?
Yeah.
All right. Can you zero the device for me, please?
Back to right side.
Yes, back to right side first. Okay. Okay. Push up for me. 1, 2, 3, rest. Push up for me. 1, 2, 3, rest. Push up for me. 1, 2, 3, rest. Done. 1 second. Okay. Push up for me. 1, 2, 3, test, rest.
Oh, God, that's a lot harder.
Yes.
Jeez.
Let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. Okay. Finish testing.
Jeez.
All right. So, let's just get a reading here. You want to sit for me, please? Okay, so this is the difference between the right leg, which is unaffected, and the left leg, which is affected.
Yeah.
You got that? Okay, guys, so we've just completed the testing, and this is the difference in force output between the right leg and the left leg. So with knee extension, which is the quad, on the right leg, the overall output is 193 Newton meters of force. On the left leg, it's 164 Newton meters. Okay, so that's a difference of around 30. Yes. Yeah. Okay. Knee flexion. On the right side, it's 157 Newton meters, and on the left side, it's 134 Newton meters. Okay. Now this is probably the biggest one. Okay. The glute. Right side 148, left side 103.
Yeah.
Okay, so that's 45.
Yeah,
Okay.
big difference, yeah.
Big difference. Okay, guys, so what we're going to do now is we're going to do our electrostimulation. We're also going to do some decompression for Harvin's lower back. We're going to work on we're going to treat him as a normal, basically lumbar radiculopathy case, which is lower back pain with the nerve impingement. But we're also going to work on the muscle stem, and we're going to see by combining these two things if we can improve some of these variables. All right?
Sounds good.
Let's go.
So really, on average, for the first two movements, hamstring and quad, we're up 12, 13% down, left to right.
Yeah.
Then glute side, it was round about 30, 40% down, 150 to 100.
Yes.
Yeah, so it's a big drop off, yeah.
It's a big drop off.
Yeah.
Yeah.
But I could feel that straight away. Where last time when we've done it, you know, where you could hang on to stuff.
Yes.
Where this time I was like, don't hold anything, don't brace, just go through the muscle. And
It's a big difference.
Straight away, 100%.
So what Harvin's talking about is we actually did some muscle testing, or we did a full session a couple of weeks ago, but it was the first time that I was doing this sort of testing for this particular injury, and our setup of actually doing the testing and setup of the device wasn't correct. So some of the readings we got were like way off, and it wasn't very accurate, which is why we've got him back to do a second session and do a little bit more appropriate testing. So that's a better indication. In fact, the last time we were getting stronger readings from the affected leg, but what had happened was the way we had set it up was Harvin had the opportunity to like thrust into, almost like doing a soccer kick.
Yeah.
Yes. And I think that's where our readings went off.
Yeah, I think this time, because I'm not able to brace.
Yes.
So where last time you can crunch down, you can brace.
Yes.
I think you
And
have
there's
to-
also a little bit of swing
100%.
in it. Yeah.
This time was literally direct on the machine.
Yes. And go.
Pushing
Yeah,
that
and that
way,
makes
yeah.
a big difference. That's pure isometric, because
Yeah.
there you had a bit of a concentric into an
Exactly.
isometric. Yeah. All right, so you're going to pop your shirt off, and we'll start with treatment.
Perfect.
There we go. Okay, guys, so even though Harvin's issue is not so much lower back pain, and it's more of an issue with motor control and how the injury is affecting his training, it's starting somewhere. If we just address the peripheral nervous system, it may improve his symptoms, but it's not going to address the entire problem. So we're going to do central nervous system, which is spinal cord, and peripheral nervous system. So we're going to start off today with some decompression. Oh, excuse me. I'm going to start working on the level L5S1 because after reviewing his images, this is the most sensitive segment, I believe. All right, you ready to go, mate?
Yeah.
Just going to leave your lower back very loose for me, okay? You good?
Yeah.
You may feel a stretch in your lower back. You good?
Yeah.
How does that feel?
Feels nice.
You feel any sensitivity on the left
No.
top of the hip here?
No.
You feel any stretching in your lower back?
Upward, less on the lower side.
Okay. Higher up here?
Yeah.
Okay. Inhale, exhale. There we go. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. And relax.
I think when I saw a doctor last year, he said, because of my back, what's helped me over the years is because I've got a strong back,
Yeah.
that's helped me. But now it's obviously the discs have had enough. That's the problem now.
So definitely you can see that with the thickness of your paraspinal muscles that you have quite a lot and potentially have quite a lot of resilience. That's probably helped you recover from the pain and the nerve compression symptoms that you were feeling.
Yeah.
Definitely, man. But of course, I think the residual muscular atrophy is a sign that it's there.
Yeah.
You know?
Agree.
It's kind of a two-part thing, right?
Yeah.
Okay. You can rest your face for me. You comfortable?
Yeah.
Yeah? Okay. What time do you need to get out of here by?
I'm in no rush.
Okay, you know, in no rush. Okay, cool.
No. I'll be in the office till like 9, 10 p.m. tonight. So.
I'm gonna, after you, I'm done. I'm gonna head to Binus,
Oh, nice.
get my steps in.
Yeah, it's too hot to be outside.
Too hot to be outside, bro. get going. So how long have you been training for?
I played sport at a good level.
What
when I
sport?
was younger. I was into football
Okay.
and I was into basketball. But if we're talking bodybuilding, probably since the age of 23.
23.
So what's that, 9 years? 9 years now?
Sorry. You may feel a twitch here, okay?
Yeah.
All right. You good?
Yeah.
Okay. Do you do any mobility work?
I try to do mobility about 3 times a week.
Okay.
Ooh.
Sorry. And what constitutes mobility for you? Like, what do you do?
Start with some core work first. Then
Yeah.
start with upper back, mid back, lower back, into
Good.
the hips, into the knees, into the ankle. You've obviously got your good mornings. Loads of stuff. Again, I could always spend longer, but I'm talking probably like,
Oh, sorry. Okay. Oh, nice. You good?
yeah. Like I could always spend longer, but let's say 15, 20 minutes, just making sure everything's well. Especially because we train in the morning.
Yeah.
Feel a bit awake, a bit more alert.
Last 2 on this leg on this side. Inhale. There we go. Put your glute min
So what's this we're doing now?
and glute med. So you're talking about the technique.
Yeah.
So this is called intramuscular electrostimulation. It's basically an evolution of dry needling where practitioners found that by passing an electric stimuli through the needle into the muscle, you have better effects when it's come to pain control as well as muscle function. What I'm doing is I'm placing the needle strategically. So With these two here, we have sciatic nerve and inferior cluneal. Here we have mid cluneal and inferior gluteal nerve. So these four are specific to nerves, and these four here are specific to the hamstring muscle. And I've placed them on either side of the sciatic nerve as it's running down your hamstring. What I'm trying to do is communicate with the peripheral nerve and change the frequency at which it's functioning at. Because right now its frequency is not ideal. Who's your coach?
Callum Racetrick. So from the UK.
From the UK, okay.
Therapeutic, very good top level coach. I've got a good relationship with him. Nowadays there's so many coaches in there.
Bro. And there are some suspicious characters that have IFBB in their title.
Yeah, agree.
One of my clients is working with a coach, and I was like, there were some suspicious things that he was getting her to do with the injury that she has, and I was like, okay, can I see his profile so that I can get an idea of how he works? And then when I went onto his profile, it's like IFBB, and I'm like, do you know you need to win a pro card before you can use that title in your bio?
But even then, I think that's the status that you've got, but you still should know the realms you're working with. Like, I know when I work with people, for instance, if we're talking investments, I'll talk to them about mortgages to some degree, but I'll say mortgages is not my area of expertise.
Yes, you're going to refer them on to someone.
Likewise, if I speak to someone for coaching online now, if it's injury, I know so much, but I'll say, right, refer them on to someone else. Again. You know, you can't be someone that knows everything, because no one does.
Okay,
one
second, you're going to feel this pulsation quite strong coming through the leg.
Oh,
How's that?
I can feel it in the glute.
Okay guys, so we have just completed a multi-stimulation focusing on glute med, glute min, glute max, and a quadruple stim or double stim on the hamstring. So now let's get you to turn over and work on the quad. So Harvin was just asking me off camera what got me into chiropractic, and I was just elaborating on my experience with having disc injuries and nerve pain. What happened was when I got into university and I started learning about these types of injuries, our lecturers would always say, if a patient presents like with X, Y, and Z, you got to refer to the orthopedic. And I felt like as a profession, we were very fearful to manage patients like yourself, purely because we didn't have the skills to do so. So in 2018, I went over to Mauritius and I did a orthopedic fellowship with a private hospital there, working with a chiropractic team and orthopedic team. And my main area of specialization during that time was disc injuries. Disc injuries, degenerative discs, spinal stenosis, which is a condition that affects older people when the disc degenerates and it occludes the spinal cord itself. And it gets numbness and tingling in both their legs. And the second part of it was athletic injuries, in particular tendinopathies. So most of these skills that I'm working with you on today, I learned during my orthopedic fellowship, and I perfected during that 3-year period. Okay. You good with the needle so far?
Yeah, fine. No complaints.
No complaints. All right. So this is actually the first time that you're really doing treatment for this injury, yes? Go, nice twitch. You know, another way to learn is when you're constantly injured.
100%. 100%. You learn so much more. It's constantly reevaluating, reassessing.
Yeah.
That's the biggest thing. Ooh.
You good? So this is your femoral nerve.
Yeah. I feel that.
You watching the NBA playoffs? Are you keeping up to date?
I
Or
just don't have time, honestly. My life at the moment is so busy. I'm so grateful for it as well.
that's good, man.
It's constantly up. You drive somewhere, you train, get to the office, you work, you go to a meeting, you go to a briefing, you make calls, you meet clients. But I'm trying to find that good life
Balance.
But I think that's why we both train in the mornings, we get it out of the way. That's our time.
Yeah.
And I notice when I train in the morning, my phone's quiet.
Yeah, I always preferred for ages to get, well, actually, when I was at school and uni, I would train in the evening.
Yes.
But once I got out of uni and I actually started working, I definitely preferred to train in the morning. Start your day early. In fact, back home, some mornings I would, when I was training CrossFit, I would do the 5 a.m. class.
Oh wow, okay,
and get out of there, get to the office,
Yeah.
start work at like 7:30
Yep.
because patients want to come in early,
Yeah.
and be out of the office by 4.
100%, yeah. I've noticed as I've come to Dubai, I've got earlier and earlier. First it was at 6 p.m, then it was 1 p.m, then it was 11 a.m. Now it's 5 a.m.
Yeah, back home, if you wanted, you could open your practice at 5 and work like 5 till 3.
Yeah.
People would come in at that time.
Yeah,
You know, lots of early
yeah.
early risers.
Yeah.
When I got to Mauritius, when I was doing my specialization, I tried opening the practice at 8.
Mm-hmm.
No one turned up, bro. People would book and not turn up.
Yeah. I think as well, when you train at, for me, training in the morning, there's a different type of person in the gym. In the evenings, you get people who are there to socialise. In the morning, it's
Yeah.
generally you get professionals in the morning. Everyone's off to work, everyone's doing what they have to do. There's not that chit chat.
How's that?
Good.
Not too strong?
No, it's okay.
So we in your rec fem and we in your VMO. And we targeting the femoral nerve and the saphenous nerve. The issue I have is inherently I'm an athlete and I forget that, well, as an athlete, the competitive nature is there, right?
So, yeah.
You get carried away. Alrighty, so time for us to retest.
Perfect.
Let's get you to sit for me, please, and face this way. I'm looking forward to seeing what comes back.
Oh yeah.
Set this up. All right, so we're just going to go with the left leg. Yes, let's get this up. You can hold on to the bed for me, please. Okay, push. 3, 2, 1, rest. Push. 3, 2, 1, rest. Go. Wait. Which is 0. Yeah. And go. 3, 2, 1, rest. Done. Okay. Knee flexion, left side. Let's get you face down, please. Let's get you here. Okay, 3, 2, 1, go. 3, 2, 1, rest. Three, 2, 1, go. 3, 2, 1, rest. Lift up for me. Hold. 3, 2, 1, go. 3, 2, 1, rest. Done.
That one was surely more.
Yes.
That I felt 100%.
Okay. We're going to go with the glute now, okay?
Yeah.
All right. 3, 2, 1, go. 3, 2, 1, rest. Go. 3, 2, 1, rest. Go. 3, 2, 1, rest. Great. Okay. Let's get you to sit for me, please. Okay, guys. Let's go. Okay. So, knee extension is up by 11.9% to 184 Newton meters. And we will go through it a little bit more in detail, right? In a second. Knee flexion has improved by 42.3%, 191 Newton meters. Hip extension, glute max, it's improved by 52%, 157 Newton meters. So let's have a look at...
That was noticeably different, to be fair.
Yeah?
When I could feel that the most out of everything.
Yes.
I was like, there's more.
This is much better
Yeah.
than the last one.
101 before.
I'm gonna give me 1 second. View test summary. Okay. So previously your left leg in knee extension was 164 Newton meters. Okay. Now 184. So up by 20 Newton meters. Okay. Your knee flexion was 134 Newton meters before we treated you. Now 191. So like up 60 Newton meters. And your hip extension was 103 Newton meters. And now 157, so up 54 Newton meters. That's a massive difference. And then you could feel your ability to flex the hamstring and extend the hip
100%.
as well.
Yep.
Okay, guys, that was a very interesting session.
Yep.
Definitely better than our first one. And I must say the reason why we didn't post the first one is because, again, how we tested wasn't appropriate. We didn't get good quality readings, and as a result, I think it wouldn't be good for us to put that content out. This is much better because our testing is more appropriate. The device is calibrated appropriately, and now we can really see the effects of treatment. All right.
Yeah.
Okay, guys, that brings an end to our session today. If you like this video, please hit the like button. Please subscribe, and if you have any questions on Harvin's case or what we did, please drop it in the comment section below. Would you like to share with our viewers where they can find you should they like to do any online coaching?
Sure. So if you're looking to change your physique, hit me up on Instagram on _the lifestyle club.
There we go. We will drop a link to Harvin's profile in our caption section. Okay, guys, I look forward to seeing you soon. Take care.